My name is Claudine Burton-Jangreau. I'm a sociologist at the University of Geneva, Switzerland. I have been working in sociology of health since the late 1980s. I then started working in public health institutions, and I participated to projects focusing on HIV/AIDS prevention and cancer prevention. At that time, I got interested in the way people actually think about those risks and how they make decisions in their everyday life based on the information they receive from public health campaigns. Later on, I developed projects on vaccine hesitancy, which was an issue way before the COVID-19 pandemic erupted. I also worked on prenatal screening and genetic screening. In all those cases, these ideas of what is good health, what is illness, and what does risk mean are central, and the research shows how much they are complex notions that really need to pay attention to the way people define them and understand them in their own context of living. Next to that, I also have been working on health inequalities with a life course perspective. The life course perspective has been pushed in my university here in Geneva, and it's useful also in the context of health to think about how people's health is actually building over their life course and what are the multiple influences they encounter that will have an impact on their health. And these influences can be individual or family related, but of course, they also influences related to the social context, to the institutions in which people live. This kind of approach requires longitudinal data that also allows, when possible, comparisons across countries, across contexts, and it's providing an interesting in-depth analysis of how health inequalities are shaped over different periods and across different social groups. I was also asked to comment about the future I see for sociology of health. In fact, I see many opportunities for sociology of health. Today, we see many challenges with the biomedical approach to disease because of the limitations of this specific technological narrow approach to bodies and to their dysfunctioning, and because also of the costs of this biomedical approach. More and more, there are calls for considering health outside of the medical institutions, to think about health as part of the society's fabric. And this gives responsibility to societies also to put in place environments that are favorable for population health. And in this shift, I see growing demand for sociologists of health, and a growing interest also for all the social dimensions that impact the way people can be in good health, how they think about they can take care of their health. And definitely this will be, the expertise of sociology will be important to shape those future societies. That's why I'm fairly confident about the fact that we have something to provide in the coming decades.